Okay, I owe you a video pertaining to how I perceive the field and the profession. So first of all, there's a very easy distinction between clinical exercise physiology pertaining to chronic diseases um, and how to, through exercise, to give them back or retrieve abilities, either partial or complete, um, due to rehab, and exercise physiology, which does not necessarily um, deal with chronic diseases, um, and basically can be applied or can be in regards to healthy or um, people that are thought to be healthier or not risk stratified yet people. I think that clinical exercise physiology is the highest level we can aspire to. That means that you must learn about dealing with the healthy population first. Um, Although the word applied is well determined when it comes to applied exercise physiology, I'll still say that we are applying our knowledge uh, to all the populations, and that's why we took the program to be in clinical exercise physiology, in order to give you the maximum populations that you can work with. Um, I think that traditionally the field focuses on cardiovascular and cardiopulmonary rehab. I think that the field um, should be extended and will extend towards renal rehab, which exists, but not as strongly and profoundly as the other two. I also think that we are not even close to starting to utilize our abilities in the field of mental health and exercise. I think that metabolic diseases are really pretty well defined. I think that bariatric surgery, although it's well established in the world and has been around for a couple of years, we don't see enough exercise physiologists and clinical exercise physiologists working with this population, which is obviously a mistake to not have them working with this population. Personally, I have no doubt that genetics is going to become a tool, a profound and significant and important tool leading to treatments and exercise prescription. We will talk about that more in lab week, and I'll explain to you about what I'm doing in that field, which is completely new and I think promising and also exciting, if you ask me. So the notion of prescribing exercise according to a person's genetic information. Obviously, we're talking about certain genes or mutations or SNPs, SNPs that are related and relevant. In the U.S., I think that the profession is not yet well defined in the minds of the majority. I think that in the future years, the advocacy for the profession is going to grow. We are witnessing the start of licensure for clinical exercise physiology, which is very important, meaning that you have to have a master's degree in the field and a certification, which would probably, I'm guessing, be the RCEP, the Registered Clinical Exercise Physiologist, or something equivalent to that, by the American College of Sports Medicine, ACSM, or others. And that will definitely allow us, A, to bill the insurance of the patients, the clients, which is extremely important, to the and is one of the major reasons that a CEP might not be taken for work, employed. And also, you know, it will open more jobs because those who are conducting rehab right now that do not withstand those criterions will not be able to do that. I definitely think we are the right professionals and clinicians to do so. And I think that other professions have to respect that. Exactly like we respect them, by the way. I think that a clinician in the field needs to be able to see the person as a whole, to see them as people, persons first, humans first, and only a disease later. You have to be able to see and pertain and relate to the whole person, not just the clinical aspects of the person. You have to know the person, you have to get to know them, you have to invest time in them, you have to gain their trust, even more than their respect. And you have to prove time after time that you are worthy of their time, trust, and respect. I think that we are in a profession, I know that we are in a profession, whereas during the day we need to put aside all the hardship that our personal life can include. Even on your worst day, you have to be able to care about someone else, even though that's not what you really want to do. You have to be able to produce a true and heartful smile and attitude, and that's not easy to do, you know. It's not easy to do at times, but that's the profession that we chose. I think that that's one of the reasons that we are respected, that people understand that on top of our problems, our job is to deal with their problems. And when they see that you are a full clinician, meaning that you relate to the whole person that they are, and actually care if they saw their grandchildren today or this week, actually care if they had fun for Christmas, when's the last time they traveled, you actually care to mediate and coordinate between different professionals and clinicians that might affect their life, like the nutritionist, like the diabetic instructor, like their personal physician. Then definitely your rapport and your reputation and the responses that you'll get from them are completely different. You can definitely treat the disease before you treat the person. I suggest that you get to know the person as fast as you start treating the disease that they have. So that's my take on the profession. I try to make it as short as possible, and you know, think about the things. Think about the things. I think this is an amazing profession, very rewarding at the personal level, lots of information to know, and many avenues to find satisfaction in your work. See you around. Bye.